There are several reasons why the health of women matters before pregnancy. The first is the steady uptick of maternal mortality in the U.S., far surpassing other industrialized nations. Second, black maternal mortality is a public health crisis. The risk of pregnancy related death is 3 to 4 times more likely for black women, and they are 2 times more likely to suffer from life threatening pregnancy complications. Another reason examines the health of Delaware's reproductive age women before they become pregnant. Data shows close to 50% of this cohort has one or more chronic disease conditions, and over 50% are overweight or obese. Finally, more consideration must be paid to women's emotional and mental health. Less than 20% of reproductive age women in Delaware are checked for depression. While Delaware has made significant gains in reducing unintended pregnancy rates, opportunities for improvement remain. Nearly 50% of reproductive age women in Delaware are still not planning their pregnancy. Finally, infant mortality rates of disparity are more than double in black and brown communities. Taken in total, it is clear we must get to women much earlier before they become pregnant, because a critical period of development for poor pregnancy and reproductive outcomes has already passed by the first prenatal visit. A change is needed in how care is delivered to women, because for many decades, the annual cervical cancer screening has provided the foundation for well woman visits for millions of women in the U.S. We know that women require comprehensive care relative to their unique needs and concerns, which were not being addressed holistically under the previous standard of care. Transition to the well woman visit led by the American College of Obstetrics and Gynecology, who in partnership with other national stakeholders launched the Women's Preventive Service Initiative, developing new guidelines and recommendations. This transition was not without challenges. Knowledge gaps arose with respect to changes in the standards of care. Two key challenges are inconsistent pregnancy intention screening among all providers and low reproductive health awareness and no reproductive life planning. Delaware's approach to well woman care is straightforward, stressing reproductive life planning for all women and men of reproductive age, asking a pregnancy intention screening question, and ensuring that women complete at least one well woman visit a year. Delaware approached the Well Woman Initiative with 4 key goals, none more important than increasing the community's overall knowledge and awareness of well woman care. Our 4 pillars align with the well woman model of care, with one noteworthy addition, which is the identification of the social determinant of health needs with direct linkage to needed programs and services. Every Woman, Every Time Delaware supports opportunistic care throughout a woman's life course. It will take all of us, women, providers, community partners, and key stakeholders to work together. Delaware has a robust infrastructure responsive to the needs of women, highlighting our belief the health of women matters before pregnancy. The measures for success for Every Woman, Every Time Delaware include ensuring every woman in Delaware will receive a yearly well woman visit, regardless of whether a Pap screening is needed. Every time and every visit by every provider is an opportunity to promote well woman health. And finally, every provider in every specialty will ask every reproductive age woman a pregnancy intention screening question. Resources on DHMIC's Well Woman and other strategic initiatives can be found on dethrives.com.